personalities and guests alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and today we are welcoming back to the show Dr. Dennys Reyes Candedo, who is an interventional neurologist, and he's right here, Palm Beach Neuroscience Institute, and the address is 8756 Boynton Beach Boulevard, Suite 2500. That's right here in Boynton Beach, Florida, 33472, and you can reach him at 561-499-7551, and then I'll give the website. It's www.pbhnphysiciangroup.com, and then the other location is in Delray Beach, and that is at 16215 South Jog Road, Suite 204, Delray Beach, Florida, 33446. Thank you for coming back to the show.
Thank you for having me. Appreciate it.
We appreciate you coming to the show and really informing the audience about all that you do and all that we can learn about interventional neurology and how these different ailments and illnesses affect different people, all different ages.
Right. So, interventional neurology is pretty wide and covers ischemic strokes, or in general, strokes can be due to a vessel shutting down or a vessel actually bursting. There's 87% more chances of a vessel shutting down than actually bursting and bleeding into the brain. Now, if it closes down, it's usually related to whether a clot comes from the heart, from arrhythmias, or maybe there is some sort of degree of cholesterol plaque sitting on the wall of the vessel and then it shuts down. And then, or the blood could be too thick, and create clots within the blood itself. The blood flow needs to be in a laminar shape. It needs to be smooth. If there's some degree of turbulence, then there could be problems. And also, if the vessel is injured itself, it could actually shut down the vessel too, from, let's say, trauma, or motor vehicle accident, for example.
Oh, I didn't even think of that.
Or overstretching your head or neck, that can sometimes cause injuries in the arteries of the neck or the back of the neck or so. And then there's the other side where vessels, they can actually burst and bleed from an aneurysm or abnormal connection between an artery and a vein, and the blood seems to be shunting too quickly from an artery to the vein, then it can actually burst because it's a very weak connection. So it eventually could actually bleed. These connections, they can happen spontaneously, but they can also happen traumatic in the setting of trauma.
Right.
So right after a motor vehicle accident, or let's say somebody on an electric scooter, going too fast, they don't have a helmet, then they, the speed, they really damage their head, they hit their head against the, cement asphalt, and that's enough to create a bleed in the head and also create these abnormal connections, which you can actually fix with catheters and wires as well, going through the groin with catheters and wire and kind of glue those abnormal connections, glue it down.
Wow.
Yeah.
So if it wasn't an accident that a person had and it was just, let's say, an aneurysm, are there signs and symptoms? Like, does a person know what's going on? Like, do you hear of any signs of maybe somebody having headaches or?
On the bleed side, where there is a brain aneurysm, yes, they can have headaches sometimes. Typically, it's more like a pounding. Doesn't go away. It's somebody that usually does not have headaches at all, and then all of
Okay.
a sudden they're having headaches for no reason.
Okay.
You know, unless their patient has a history of migraines, then that's fine because you know they have
Sure.
migraines from before, even when they're teenagers.
Okay.
But somebody without headaches at all, then one day start
Right.
having headaches, pounding like maybe double vision, maybe some
Oh.
nausea, vomiting, then you want to get checked, you know.
Oh yeah.
It comes along with the family history. They might have some degree of family history where their father, mother, there's a sibling that had a brain aneurysm sometime in their life, and it burst, and then they needed treatment. So they might want to get a scan, just a plain scan to look at the arteries of the brain, not just the brain, to look at the arteries of the brain. There are two different scans in that aspect. Yeah.
So the two different scans, one is looking at the arteries of the brain.
Yeah.
And then one is looking at the brain
The
itself.
brain itself, yeah. So when you do an MRI, just to look at the brain itself, you might miss an aneurysm. You might miss an aneurysm. So you
Interesting.
actually need to have a dedicated scan for the arteries alone, or the veins, you know.
Sure.
Yeah.
So if anybody's listening out there, we're having a call-in. You can call in at 888-994-4995, Studio A. We're having a dedicated call-in line if you want to ask Dr. Candedo any questions, if you have any loved ones. I know there's a lot of people who are taking care of their aging parents, and they are caregivers.
Yeah.
So, yeah, if anybody's listening and you have any questions, please call in, because now's the time to learn, you know, about all these different things that can happen to a person. What can we talk about as far as primary risk factors for cerebrovascular disease among senior citizens? And does that differ from middle-aged individuals and young adults?
Oh, that's what we see most commonly.
Seniors?
Seniors, obviously, you want to have them check their blood pressure, cholesterol, their glucose, sugar on the, I would say, on a yearly basis. I mean, there is a point that they might have difficulties controlling their blood pressure. They need medications then, right? Or their cholesterol seems to be high, especially the bad cholesterol is what we call the LDL. That's the one that kind of goes into the wall of the vessel and makes the plaque grow and obstruct eventually the blood flow. We see that commonly in carotids. You know, carotids, when you say, oh, they have a blockage in the carotid, you do a carotid ultrasound, for example, and there could be a blockage right there. Again, that's related to aging, blood pressure, cholesterol, even sometimes sugar problems can facilitate the process of building a cholesterol plaque in the arteries of the neck. But that also can happen in the arteries of the brain, same way that happens in the arteries of the heart or the kidneys. So it's just more of a systemic process. You want to control that by taking care of all these risk factors, again, blood pressure, cholesterol, your sugar, and that implies taking care of your diet.
That's what I was going to ask.
Right?
I always
So-
go back to diet and ask.
Yeah.
I love to ask the doctors,
Yeah.
what can we do as, you know, just a regular person who wants to prevent this? So,
Right.
diet, you recommend a healthy diet?
Healthy diet, quote unquote, what we know healthy diet, right? We have done some research. I mean, the American Heart Association would recommend favoring Mediterranean diet
Yes.
style. Now, that Mediterranean diet includes good oil, right?
Yes.
You have white meat in general, you have chicken, you have fish, but everything is grilled, nothing is fried.
Right.
Okay, it's
Right.
all grilled. And then you have nuts and vegetables, everything low salt kind of thing. But you focus on good oil and good intake of protein, of course. You know,
Right.
minimize the carbohydrates as much as possible. Or maybe focus on complex carbohydrates, you know, not just the simple ones, you know. And but Mediterranean diet seems to lower the risk of having strokes overall over time. And then there's exercise, of course.
Yes.
Which, you know, American Heart Association recommends for us to be doing 150 minutes of moderate cardiovascular exercise a week. So that roughly maybe 30 minutes every day of some degree of moderate cardiovascular exercise, where you feel a little bit of short of breath when you're doing so, when you're doing the work.
Yeah.
And that's for all of us. That's
Oh,
just
yeah.
not. That's just not for it's all of us.
I know, because use it or lose it. If I can't do it
Yeah.
now at 50 something, I mean, I have to, I want to make sure I'm doing this now. So I know
Exactly,
I'm
yeah.
practicing the best I can to exercise, because I guess those are the things that we can control, right?
Right.
Good
Those are the things,
exercise, good diet.
Yeah.
What else is there besides
Well,
that?
stay away from toxins, right?
Uh-huh.
The smoking, the alcohol,
Right.
obviously drugs or so. Those are the things that we're not created for. We have them available, but we were not created to be exposed, right? To smoking itself, to get exposed to alcohol, because we were not made, evolutionary speaking, to be, to tolerate those things. Even simple sugar, right? Simple sugar, it's too easy for us to be to get it absorbed. But I mean, evolutionary speaking, we were not ready for that yet.
Yeah.
I think.
And
So.
with all these processed foods nowadays, and sugar is available everywhere, it makes it a little more challenging for us trying to maintain a healthy, lifestyle.
Right. Yeah, you eat simple sugar, and your sugar on the blood it spikes really high quickly, huh?
Yeah.
So
Yeah.
that means a lot of work for your body.
Yes, it does. Anybody listening, you can call in 888-994-4995, Studio A. So let's talk about if you are with a loved one and you think they're having a stroke, when
Right.
you're not sure. I know there's an acronym, the BFAST acronym. Let's talk about that. And what do you
Sure.
suggest for somebody who they think they see their family member having a stroke? What would you suggest?
Yeah, BFAST stands for every letter comes up with a word, kind of like to give you a hint of what you should be looking for, right? So B is for balance. If your family member, friend, or even the neighbor is losing their balance all of a sudden without no explanation, I would say even kids, they need to know about this.
Yes,
Yes. The grandkids. The E stands for eyes. So if there's vision loss all of a sudden, especially on one side or maybe just one eye or seeing double too, that'll be one thing. F stands for face, facial weakness. A stands for arm, it's drifting. The arm is kind of falling down compared to the other.
Right.
Then S stands for speech. He has speech difficulties, or they're having slurred speech, or they're not comprehending. And then T stands for time, to call 911. Obviously, they want you to just don't waste time, to get the fire rescue team to see you as quick as possible so they can direct you to the right hospital in order for you to receive a clotbuster medication if you apply for it, if you meet the criteria.
What kind of medication did you say? What is
It's
it?
called TPA.
Okay.
It's a clotbuster medication. There's another one called TNK2 nowadays. We have two available overall. But they're both clotbuster medications, but you only have 4.5 hours to get the medication.
Okay.
And you have to meet very precise criteria
Okay.
to get that, to be able to get it. But yeah, so if everything is in line, then you could potentially get the medication. And if a big vessel is completely obstructed, you still also have time to get in, go through the groin with catheters and wire, and clean the artery, unplug the artery, get that clot out of the way, restore the blood flow back to the brain as quick as possible. Every minute counts. You're losing about 1 million or so neurons every minute that brain is not getting blood flow. Yeah.
Wow.
Roughly.
So does that help? Does that medication help reduce the permanent damage, maybe of
Right.
some permanent damage people would suffer from?
That's the idea.
Okay. True. Right.
So there is risk with the medication alone, 6% risk of having a major bleed problem. Okay.
Okay.
But then you have the counterpart. You have 30.
Okay.
30
We have a quick commercial break. We're going to
Sure.
continue that conversation. We'll be
Of
right
course.
back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in to You and Your Doctor. We have Dr. Dennys Reyes Candedo, who is an interventional neurologist right here at Palm Beach Neuroscience Institute. I'm going to give you the phone number. Please call him at 561-499-7551. And we're getting a lot of information I love to share with my audience so that they can be aware. And we were discussing right before the commercial break the BFAST acronym. We were completing with how important it really is, so people get to the hospital right away.
Yeah, that's right. Yeah, the clotbuster medication, that's right. We have two medications nowadays, TPA and TNK. But the idea is to restore the blood flow, even if it's a small vessel. If the clot is small, there's high chances that that clot can actually be broken down by the clotbuster medication. If it's too big, that's why we get involved, and we call mechanical thrombectomy. It's mechanically you're going through with catheters and wire, going through the groin to remove that clot out of the way and restore the blood flow. Because there is a chance that the medication might help, but if the clot is too big, it might not necessarily dissolve all the clot. It could dissolve it if it's small enough. Right, but when it's too big, then you really need to help the body a little bit more sometimes. We do see exceptions, though. There are patients, amazingly, that with the medication, the clot will get better, will dissolve, you know. But those are one in in a few.
That's a miracle,
cases.
right?
Yeah, miracle cases.
So let's talk about what happened recently. We were just discussing previously about I think it was Miami Dolphins. What was that scenario? I don't really watch that much football, but I know we were discussing that. Can you share with the audience a little bit about that?
Quarterback Tua, one of the it's very important playing for the Dolphins, right? So we follow him very closely, as he was running into the line with the ball itself, he hit the right side of the head, and also you can see how he's flexing his neck, overstretching his neck a little bit against the player, and suddenly obviously he falls down and he starts contracting his hand, and everybody became very concerned about that. Because when you see that, right, I mean, you fear that he's having a concussion right there. So. Or a seizure, I don't know. It didn't look like a seizure because he wasn't convulsing on the field itself. Fortunately, he was able to stand up quickly and walk out of the field. So that's actually good news. And a few minutes later, I think he was already back to normal. So that's good. But that the effect of the trauma itself of the encounter, initially, it just raised the concern for concussion right away. And because this would have been his fourth, I believe, his fourth concussion.
Wow.
Yeah.
Yeah, so that's a lot. At what point does a doctor say maybe that's a big risk factor, I guess?
It is. It is a risk factor for concussions and problems down the road in the future. We use it as an example because we see that most commonly in motor vehicle accidents, right?
Oh, true.
You know, so that's they get the whiplash.
Right.
Some patients will get whiplash, or they get their head hit against a window or so. So that shaking, the skull is very rigid, and the brain is very soft. So it create the brain starts bouncing against the skull.
Sure.
So it's such a rigid cage, and then you get a what we call coupe contre coupe injuries. So brain it shakes in favor of the motion, but then it bounces back. So when it bounces back, it can create a bruise in both ways.
Oh, yeah.
Yeah. So then that bruise could be a bleed itself, or the shaking could be so much that it can injure the axons and the connections within the brain itself.
Okay.
So
We actually have a caller. So
Oh.
someone's calling in. Please, please announce yourself.
Hello, my name is Edward. I'm a first-time caller, but a long-time listener of the network,
Thank you
and
f-
a
thank you for
long-time
calling.
South Floridian and sports fan of the Dolphins.
Oh yeah.
So, Dr. Reyes Candido, can I ask you your opinion on what so many people are probably also asking you inside and outside of work? What are your feelings on the Tua injury, and how are you looking going forward?
Yeah. Thank you for the call. Thank you. Yeah, I think, medical standpoint too, should be evaluated, or should have been already evaluated by now, with the medical field, the medical team at the Dolphins, of course. So they will usually do an MRI of the brain to evaluate the integrity of the brain itself, and to see if there's any brain spots. Bleeding spots in the brain. When you see bleeding spots in the brain, that's when you really become concerned about.
Right.
The other thing that we look for is white matter changes. Could be spots that happens around in the deep structures of the brain. If you see many of those over time, and they're spreading or they're growing too quickly, then it just raises concern for residual deficits on the and the brain, and potential problems down the road, long term.
Right.
Which could be cognitive, memory, attention, fatigue, tiredness, risk for seizures. Those things, they come on the long road, not right away.
Right.
Not right away. There's some effects you can have right away, like headaches. Headaches will be a common thing to have initially. But I think he's been doing okay so far. I just don't know. Obviously, I don't
Right.
know what kind of studies he's had before. But I would think they will be comparing or any recent images to the ones done before. That would be a great idea to do. Compare all the images for this
Sure.
past, quote unquote, 4 concussions that he had.
Yeah, it's a lot.
Hopefully there's some pictures. But overall, I mean, you want him back in the field because he plays really good, right? So, I mean, you just hope that this is not going to happen again. But it's a common thing to see. It's approximately 3.8 million annually
Wow.
people will suffer a traumatic brain injury, right? It's somewhere between 1.7 to 3.8 million people suffering some degree of traumatic brain injury. So it's just he's on TV, obviously, but
Sure.
but we know there's a lot of people suffering out there, whether on a bike, on a scooter, electric mobile, whatever, or a car itself. That does expose you to get traumas, and
Yeah.
so it's just an opportunity to raise awareness.
That's what I was just going to say.
Yeah.
You know, yes, go ahead.
Yeah, so that was a great explanation. And what about the timetable? I know it probably would be a severity of the injury, but have you seen cases specifically where the brain has been able to heal itself in concussions?
Yeah, it typically does. I mean, it heals pretty well. You see sometimes what we call a little mark, right? A little white spot or so, the one I was mentioning before. but is irrelevant as long as it's not causing any symptoms. You could have a white spot, which we see actually in patients with migraines very often, but it's not relevant as long as it's not causing any neurological problem. But yes, or a scar, right? A little scar somewhere, a little small bleed spot inside of the brain. Now, if you have too many bleed spots, let's say more than 10 or so, then that's kind of concerning. So quantity, the size kind of matters, the amount of white matter or spots itself, it does makes you, increase concerns for issues. So you want to have a repeat MRIs very often, maybe every year or so. Make sure they don't get worse.
I can't believe this interview is already, it's almost over. We have 30 seconds left. If you want to just wrap it up and whatever you want to share with the audience, maybe any takeaways or suggestions for them.
Yeah, just be aware of potential symptoms like including headaches and neurological deficits that they might seem to be very mild and not relevant. And we try to sleep it off. Some patients that I hear, I'll just try to sleep it off, go to bed and see if it gets better. I would just make sure, take it seriously, and pass by ER, get a CAT scan, maybe call 911 if symptoms are very obvious, like facial weakness, speech problem, vision loss of balance. You don't want to waste time. Just call 911, let the fire rescue take care of you, and the ER doctors as well, so they figure out, as quick as possible what to do.
Well, thank you so much for coming back again and raising
Pleasure.
awareness for our audience. Again, I'm going to give your number out, 561-499-7551. Please call and make an appointment. Thank you so much, everybody. We'll see you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.